A doctor who worked at the Tavistock and Portman Foundation for 12 years has raised concerns that the NHS is steering vulnerable young people towards organisations which he describes as transing factories. Dr. Az Hakim, who now works on Harley Street, thank you for coming. And this is your new book, Detrans. I think a lot of people won't know what is meant by detransitioner. What is a detransitioner?
Detransitioners are the people that you're not supposed to know about. So they're the people who at one point believed that they should be another gender. They may have gone through social, hormonal, physical, surgical changes to their body, and then at some point realised, actually, this wasn't the right thing to do, and so they revert back to their original gender. They detransition. Yes.
Now, I've spoken to some people who fall into that category on this very show, and the same story keeps coming out, is that they feel like they were misinformed, that they were even pressurised to make these irreversible changes to their bodies, and they regret it. I mean, it's a really kind of shocking situation, isn't it?
It's terrible, and for 12 years I set up a specialist adult gender dysphoria psychotherapy service, the only one in the country, and that was at the Portman Clinic, and 26% of the patients I saw were regretters. And they talked about this stage of gender dysphoria and then transgender euphoria and then a bit later transgender dysphoria. And there was a sense of inauthenticity about themselves which then lingered. And what people don't talk about is actually trans isn't a thing, it's lots of things which are now unhelpfully labelled as trans. So in the book I talk about what on earth is a thing called trans, because nobody talks about transvestites anymore, but there's always been far more transvestites than transsexuals, but they're all trans now, so they're all the same.
But you're talking about the gender affirmative model of care, where someone comes along and says, and they can be a child and say, you know, I feel that I'm in the wrong body or something like this, and the specialist, the paediatrician, is expected to merely affirm that belief that they have about themselves. Now, activists say that if you don't affirm that belief, there's a high risk of suicide.
So in the book, I debunk loads of myths. So the myths are people are born in the wrong body, people are trans from birth. If you don't give a trans-identifying person affirmatory interventions, they'll kill themselves. This is all nonsense. There's no data to suggest any of that. There's also this myth that only 1% of people who transition regret it. There are no follow-up studies. You know, if you have an operation on your little finger, there'll be tons of evidence-based follow-up studies, but in gender dysphoria and sex reassignment, there isn't. So there's a hope that if you give someone what they want, they'll be happy with it. And my patients who are regretters and detransitioners, they all said the same thing. They all said, well, when I decided that I should be the opposite sex, everyone just affirmed me. And when they regretted it and they went back to their families, their employers, their friends, they're saying, why didn't you just ask me why I was thinking this? And they all said, because we were being supportive. That's what we thought we're meant to do.
Well, that raises another issue, is that the Labour government are saying that they want to ban what they call trans conversion therapy. But by that, what they mean is they want to ban this kind of therapeutic, explorative...
So the therapy I did was merely a thoughtful thinking with someone. And a bit like with, you know, with my maths A-level, which I was terrible at, you know, you think in a series of, you know, sequential processing, and if you get a bit wrong, you might end up over here rather than over here. So what I do with my patients is they come with the solution of, I should be the other sex. And all you try and do is say, OK, fine, how did you get there? And where did you start with? How did you get to that conclusion? And what you'd hope is that if you had a child, let's say a 5-year-old or an 8-year-old, who says, oh, I think I should be a girl or a boy, what you'd hope is someone clinical would say, really, how did you come to, like the maths teacher, how did you come to that conclusion? Not, no, you're not, but how did you get there? Help me understand how you got there. And affirmation therapy doesn't do that. Affirmation says to the young child, yes, you are born in the wrong body. And myself and a number of clinicians, I'm part of a group of CANSG, Clinical Advisory Network for Sex and Gender, we're really concerned about this pro-affirmation model, because affirmation sounds good, doesn't it? But actually it's grooming. It's colluding with a false notion and grooming a child into thinking that there's something they're not. Whereas we would say, no body is wrong. You know, if you feel you don't fit in, help the child fit in and understand that they can be whatever they want to be. Don't convince them that their body is wrong and they need to mechanically, surgically, hormonally change that body.
But there have always been, haven't there, individuals who, for whatever reason, do, in order to feel happy in society, do need to either present as the opposite sex or to undertake surgery to reach that point. And there are many people who fall into that category who say that they don't regret that, and that it was actually life-saving for them. Do you accept that?
Well, we don't know whether it was life-saving. They might not regret it, but they don't know whether it was life-saving. It's a symptom. Believing that you're another sex is a symptom. It's not a condition. It's a bit like a cough. If you have a cough, you might have something stuck in your throat. You might have lung cancer. You might have a chest infection. But the presenting symptom is a cough. So if a patient has a presenting symptom of thinking they're the wrong sex, that's not necessarily a condition. It's a symptom. And what you want to find out is how they got there. And what we do know is that there's massive coexisting conditions like autism, trauma, internalised homophobia. If I look at the sample of patients that I had, 100% of my males were on the spectrum. And they had a sense of...
On the autistic spectrum?
On the autistic spectrum, sorry, yeah. And they had a sense of something not being quite right with them, probably because they were a bit different and not fitting in. And then they came to the idea that maybe they were the wrong sex. And the ones who seemed to be happy with the outcome were the more autistic ones.
Right.
Because they believed that if I look like a woman and people call me she and her, then they must think I'm a woman.
So in that case, if we go along this line of what they call social transitioning, so the idea that when a child says they're in the wrong body, the teachers and the peers all refer to them as the other sex.
Colluding, yes.
That can actually have an effect in terms of...
It's terrible, because you're colluding with this false notion. So rather than saying to the child, there's nothing wrong with you, let's try and work with you and help you be happier and find out why you're so unhappy. Because their unhappiness is lodged, they believe, in their body and the sex. But actually, let's try and work out why they're so unhappy. It's a symptom of an underlying problem that needs to be looked at, rather than presuming that the child knows everything about what it is to be male or female. Children don't. Children are learning all the time.
Why is it you think so many of these ideas of what it means to be male or female are connected to old-fashioned gendered stereotypes? Why is that? Because I thought we left all that behind.
So going back to autistic thinking and autistic minds, they're very rule-based. And I talk about people being gender confident and gender underconfident. So the gender confident person could be subversive, can say, well, if I don't fit in with whatever framework you've got, then, your framework's rubbish. Whereas the gender underconfident person says, if I don't fit into your framework, then I must be wrong, and I need to change myself to fit in the framework. And all these children who are suddenly saying that they're non-binary and trans, in the book I talk about how actually this is just a youth subculture.
Well, to what extent is it a social contagion? Because I used to be a teacher and I saw this sudden explosion of anorexia, that kind of thing, which appears to have subsided
So
now.
in the book I talk about how rapid onset gender dysphoria, ROGD, is a subculture, and I liken it to goth Mark V, which I'm well known for saying, because when we were a teenager, my friend Jenny turned up with back-combed hair and purple lipstick, and she was the coolest thing ever. We said, what are you, a goth? And there was an epidemic of goth in this North Wales private school. Now, someone looking just the same will go to school, and they'll say, what are you? I'm non-binary trans. The whole school. It's not like COVID. They haven't caught it. It's just a cool subcultural thing to do, which we then mistake as having a medical condition.
And there is also a darker side to this. At the Tavistock, there was a joke among staff that soon there would be no gay people left. Hannah Barnes, in her book on the Tavistock, has pointed out that between 80 and 90% of adolescents were same-sex attracted. A lot of gay activists are concerned that what's happening here is that young gay people are being effectively heterosexualized by this
Absolutely,
movement.
because gay people, when they're growing up, are more likely to be gender non-conforming. And when I was at Tavistock, I said to one of the people working there in the GIDS department, I said, isn't what we're doing a bit mad? And the person said to me, is it any more mad than if they were to grow up to be gay?
Really?
Yeah.
I mean, that's an openly homophobic comment.
Well, yeah, they thought it was a bit psychotic to be gay. So
I mean, I've heard that there was a kind of endemic homophobia there,
Absolutely.
and sometimes from parents who just weren't happy with the idea of a gay
absolutely.
child.
Yeah, and the thing that I refer to as the trans housing by proxy, or the trans sexogenic parent, the parents who are bringing in 5-year-olds and convinced that the child should be in the other gender because they're gender non-conforming, rather than just say, well, our kid's gender non-conforming.
I mean, finally, because we don't have much time, but I'm fascinated by this, because I've always taken the liberal view that any adult should be able to do whatever they want with their bodies, make whatever choices that they want, even if that choice is ill-informed, right? I just stick by that.
Totally.
I think we have to live like that in a society. But when it comes to children, why have we reached this point where all of a sudden we've decided that children can consent to puberty blockers, to medication that can lead to sterilisation when they can't get a tattoo?
They're chemical castrations. We go and watch films about Alan Turing and saying how awful it is that we chemically castrated gay men in the war. we use exactly the same chemical castrations on children.
But how can they consent to that?
They
How
can't.
have we
They
decided
can't.
that that's
And also,
okay?
a child doesn't know that if they have puberty blockers, there's a very high chance they're never going to have a sexual orgasm. Hopefully children haven't had sexual
Well, they don't know what it
orgasm yet.
means.
How can they give informed consent to never having that?
Well, Dr. Az Hakim, thank you so much for joining me. The book is called D-Trans. That's out now, I believe, this week. Thanks for coming onto the show, and thank you for bringing Buster as well.